begin the Congress returns to session after a not well-earned recess during the month of August, we will perhaps be addressing this issue one way or the other. So I just would like to emphasize one thing to you very briefly, and I know you know. The essence of the town hall meeting is respect. So let's respect one another's views. If you want to applaud or not for all that, that's fine with me because it does take up a little time. Let's respect one another's views. That's the essence of it. And if we disrupt, then obviously it does not give us a chance to, not only for you to hear from me, but from me to hear from you. And I have learned more at the more than 1,000 town hall meetings that I've had than anything else, experience I've ever had in my political life. Because it's an opportunity for all of us to learn and all of us to join together as Americans for the good of this country. So I want to just mention that to you. Now, first I'd like to discuss with you the issue and some of my views on it, and I'll do it fairly quickly, and then I will respond to your questions and comments. But before I go any further, Pastor Dan Yeary, I thank you for your hospitality here at my church that I and my family from the North Baptist Church. First of all, let's make one thing very clear. We all want to reform the healthcare system in America. The system is broken. It's broken because the costs are out of control. Now, I believe, I'm convinced that the highest quality health care in America, in the world, is in the United States of America. The problem is not the quality of health care in America, it's the affordability. It's the inflation and increasing costs of health care that have made it not available to more and more Americans. So our goal, in my view, is to preserve the quality of the health care in America, yet make it affordable and available to all Americans. Now, we have different views on how to do that. Now, to emphasize my point about the cost, as you know, there's a thing called the Medicare trustees. These people are people who oversee the Medicare system and the Medicare trust fund. Now, they have said that the Medicare trust fund is going to go broke in 2017, just 8 years from now. Just 8 years from now, there's not going to be no money left in the Medicare trust fund. So obviously, we need to act. Now the question is, how do we act? Now, in my view, you can't consider this completely without understanding the fiscal crisis that we are in already today. Now, let me just point out to you what we've done, and I apologize if you can't see that. I'm going to read it. This is the year 2009. The stimulus package, $787 billion, $1.1 trillion when you count the interest. $700 billion for TARP, the bailout of the banks and the financial system. $410 billion in the omnibus fiscal year appropriations bill, of which, by the way, there was 9,000 earmarks, 9,000 pork barrel earmark projects, your money, which was corruption. My friends, there is corruption in Washington.
No. Really?
And it's in the form of these earmarked pork barrel spending projects which go on and on and on. We now have former members of Congress residing in federal prison because of this system. Americans reject it. So, where's another $410 billion? $3.5 trillion in the budget resolution, $83 billion. You know, we now own two Chrysler and General Motors. $33 billion for the Children's Health Insurance Program. And now the plan that has gone through the Health Committee in the United States Senate and is ready for vote by the full House of Representatives is an additional $1 trillion to $2 trillion. Now look, what we've done is we now have a public debt of $11.7 trillion, and they just announced 2 days ago there's an additional $2 trillion in the next 10 years, from $7 to $9 trillion. We cannot sustain that. We cannot sustain that. What we've done here, and Republicans are guilty too, my friends. That's right. What we've done here is we have committed generational theft. We have robbed our children and our grandchildren and are laying this debt on them. That's unconscionable, and it's not America. So the reason why I bring this aspect of it up to you is because we cannot continue to expand programs and expand government without paying for it. By the way, there is no plan at this time for a balanced budget at any time. At any time. So what have we got now? We've got plans that are pending both in the House and the Senate. Here's the one that went through the United States Senate. Okay? 600 pages. 600 pages. What does it and say? That doesn't account for the financial side of it, which goes through another committee. 1,000 pages is the bill that was going through the House. I sat the words that you got because I threw this bill with in the Health Committee, of which I'm a member. Not one amendment that would have curbed the cost of health care in America was accepted, and the votes went down by party line basis. I'm sorry to say. There has not been bipartisan negotiations which are necessary if we are going to come up with a solution to this problem. So let me just mention to you what the Congressional Budget Office said about this plan. The Congressional Budget Office is a nonpartisan group that says that that gives us the cost estimates for various legislative proposals. It said, and the director's name, Elmendorf, he said, on the contrary, the legislation significantly expands the federal responsibility for health care costs. The changes we have looked at so far do not represent the sort of fundamental change on the order of magnitude that would be necessary to offset the direct increase in federal health costs, including in the insurance coverage proposals, and asked if the cost is reduced over time. The director said, no. The way I would put it is the curve is being raised. In other words, we are possibly enacting a legislation which will increase health care costs rather than decrease them over time. Now, there's been in addition to that, my friends, I'm sorry to tell you, an increasing influence by the special interests in Washington, D.C. Let me give you one great example. That's the drug companies. The drug companies came to the table, and the drug companies demanded that in return for an $80 billion reduction in the cost that would be passed on, they got a deal at the White House. Now, they've got lobbyists, they've got an army of lobbyists in Washington, but their head lobbyist is a guy named Tozan. Now, he gets paid over $1 million a year. Let me tell you what he was quoted in the newspaper as saying, quote, the pharma, that's the drug companies, are spending $150 million supporting the reforms. He said, we were assured, quote, we need somebody to come in first. If you come in first, you will have a rock-solid deal. He's talking about negotiations with the White House. Mr. Tozan said the White House had tracked the negotiations throughout, ascending to decisions to move away from ideas like the government negotiating of prices or the importation of cheaper drugs from Canada. $80 billion in savings would be over a 10-year period. $80 billion is the max, no more or less, he said. Adding other stuff changes the deal. That's not transparency in government. Nope. That's not change we need. That is same old pork barrel, wheeler dealer behind smoke-filled rooms behind closed doors that the American people reject. And the next time, you pay an exorbitant amount of money for a prescription drug, you can be glad to know that the drug companies are making billions of dollars in profits, and you can't re-import drugs from Canada, and they're not going to have competition for the provision of drugs under Medicare. That's not that's obviously something that's very wrong. So let me also mention to you what the Mayo Clinic says. We are proud to have the Mayo Clinic here in Arizona. Let me just tell you what the Mayo Clinic says about this deal. And I quote from a statement by the Mayo Clinic. Although there are some positive provisions in the current House bill, the proposed legislation misses the opportunity to help create higher quality, more affordable health care for patients. In fact, it will do the opposite. Then they go on to say, unless legislators create payment systems that pay for good patient results at reasonable cost, the promise of transformation in American health care will wither. The real losers will be the citizens of the United States. Now let me mention couple other items. Now, the so-called public option is not public option in my view, it's a government option. And I do not believe that the government runs the health care program anymore, the health care in America any more than they could run cash for clunkers. Sorry.
Cash for clunkers is a bad idea in the first place.
Let me remind you, there's 47 million uninsured, 5 million are college students, 9 million of the uninsured are making $75,000 or more, 10 million are illegal immigrants, 11 million are currently eligible for Medicaid or S-CHIP, and then there's 12 to 15 million people who remain underserved. We want affordable and available health care for all Americans. Now let me just tell you some of the things that we should do and some of the things that we can do. And first of all, I think you should be able to go across state lines to get the health insurance policy. Insurance reforms should improve access. Medical malpractice. Any physician will tell you that they practice defensive medicine for fear of being sued.
Get rid of the lawsuits. Get rid of most of the lawsuits and you'll get rid of a lot of the costs.
Unnecessary tests and unnecessary procedures for fear of finding themselves in court. There are some physicians, neurosurgeons in some places that pay as much as $200,000 a year premiums for their malpractice insurance. Who pays for that in the long run? Obviously, we know the answer to that. So we need to allow every American. Ma'am, you're going to have to stop, or you're going to have to leave. You're going to have to stop, or you're going to have to leave. Woman right there, please. Goodbye. See you.
Who is that?
Yeah, we don't want. Oh, yeah.
I couldn't even understand what she was saying. Did you even hear what she was saying?
Please, ma'am, if you promise, I will respond to a question if you'll be quiet. So, my friends, I want every American to I want everyone to be able to go across state lines. I think we should give every American a $5,000 refundable tax credit and to go and buy the health insurance that for those who have pre-existing conditions that are uninsurable, we have to establish risk pools, and it's going to cost taxpayer money so that every American can have an affordable health insurance policy so they can have access to it. Now, let me also mention to you that we need incentives for wellness and fitness. We need to reward people who don't smoke, who exercise, who get you obviously practice wellness and fitness, and this is not a commercial. Safeway has a program for their employees where they reward with cash those employees who practice wellness and fitness, who don't smoke, who take care of themselves, and guess what? Their health care costs have declined. Now, my friends, I saw, and I'm sure you have seen, the rate of obesity in the United States of America is appalling. And we've got to bring wellness and fitness into this equation. And we can do that. So let's have real competition. Let's have health savings accounts more affordable and available. Let's make sure that the free market can function. And I believe that we can bring healthcare costs under control and keep the highest quality healthcare in the world. By the way, on the highest quality healthcare, I was down at a place called MD Anderson in Houston, which specializes in treatment of cancer patients. There were people there from 90 countries all over the world who would come there because it's the highest quality healthcare. The same thing is true with Mayo. The same thing is true with other healthcare facilities we have here in the state of Arizona and all over America. So my friends, that's the time now that the American people speak. Before the Congress goes back into session, you have to communicate with your elected officials because these decisions will be made. And these decisions will affect not only us, but our children and our grandchildren. And I believe that this kind of forum needs to be held all over America so the American people can be heard. I'm grateful you're here tonight. I'm ready to answer any questions or comments that you have. Thank you, and thank you for being part of this.
Senator, I have a couple of questions for you. One, if government health care is so terrible, why do our veterans have it? Why do our active duty military have it?
My father-in-law doesn't like it.
Why do you have it?
Most Americans are satisfied with the health insurance that they have. They do not want to have a government health insurance.
Right.
So all I can tell you is that I do not believe that the costs that would be borne from a government health insurance system, which I just read, when they can get affordable and available health.
Well, the problem
Is the answer. What's your second question?
is the people who are satisfied are the people who can get health insurance.
That's why we have to make it affordable and available.
Competition is already there. Unfortunately, it's just
Insurance that you've got because
public option is competition.
insurance that you've got because
With my health insurance, however,
Let me just say, if we do the quote public option, which is the government option, then we have 1,501 health insurers in the country. If, however, what is going to happen if you have this government option is it's going to crowd out all the other private health insurers, and Americans will not be able to get choice of health insurance.
Hi there, Senator. My name is Rick Simon. I've been a journalist for over 40 years. I'd like to tell you why Obama won the election. Maybe you know, but I'm going to tell you why. The last 3 years of George Bush's office were a disaster.
I appreciate that information. What it has to do with health care, I'm not sure.
He was a disaster. He had the border patrol agents left in jail and things of that nature. And then, sir, when they ran you, they ran George Bush light.
Well, again, for that information, but do you have a question or comment about health care?
No, just a statement.
Oh, well, thanks for the info. Thank you. Yes. Yes, sir. Wait, I'm going to bring the microphone to you so we can all hear you.
My name is Fred Linsenmeyer. Why don't I have the health insurance that you got? Because I'm paying for it, and I'm paying for the President of the United States health insurance and Congress's health insurance. Why don't I have that? I'm the unemployed. I'm the unemployed. You work for me, and you got a better health insurance plan than I've got, and I'm paying my taxes for it.
You're exactly right. That's why I want to make health care insurance available and affordable to you, sir. That's my goal, is to make health insurance available and affordable to you.
He's not answering the
Good.
question.
I'm trying to get it for you. Thanks very much.
He's not answering the question.
We'll do it. We'll make it affordable and available to you. Yes, yes, young lady.
Mr. Senator, the debt that we have now, my kids won't be able to pay off. What can you do for me and my kids? My dad has taught me to either be part of the problem or be part of the solution. We have the solution.
Yes, thank you very much. Thank you for being here tonight. And what this is all about, frankly, and why I called on you is because if we keep this burden that I described to you before of multi-trillions of dollars of debt. Oh. Thank you very much.
I like that, dude.
Okay, this is great news. It says, 10 minutes of your time, no more budget problems, state, Arizona, no more debt, U.S. citizens. I'll show you. I'll be very interested in it. Thank you. So, the reason why I called on you, really, and most importantly, is because we're talking about your future. There's some of us in this room that may not be bearing this burden, and you are. And that's why it's important that we address this issue in a mature fashion and make sure that this multi-trillion-dollar debt that I was talking about over here is not passed on to you and your children when you become older. So thank you for being here. Yes, sir.
Hi, Senator. My name is Randy Hatch, and I have cast my vote for you every time you have come up for election and trusted you to go back to Washington and do the will of the Arizona people. Not the Massachusetts, not the New York people, not the Utah people, but the Arizona people. And sometimes I feel like you reach across the aisle, well, way too much. Way too much.
Amen, brother.
In 2005, you reached across the aisle with Senator Kennedy and passed or presented to us a bill that would have proposed amnesty to illegal aliens. And you promised us at that time, 4 years ago, that you would secure and protect our borders. And to this day, you haven't. They're still flooding across the border.
Yeah.
How can you assure us and promise us that no illegal alien will receive one dime from this health care plan?
Yeah.
Thank you for your thoughtful comment. Obviously, I make that commitment to you, and that's why I put it up on this board, because 10 million of the 47 million people are people who are in this country illegally. I'm happy to tell you that we are continuing to secure our border. We have not done that, but the number and amount of illegal aliens has dropped significantly.
Not because of your efforts.
Two reasons, actually. One of them is the economy, and the other, can I finish now? I'll let you finish, okay? And the other is because we have improved the fencing along our border. Let me tell you a big problem that we have, and that we have to work with the Mexicans if possible, and that's the drug cartels. Drug cartels now own parts of Mexico. It's a $16 billion a year business. Those drugs are coming into the United States of America and killing our children. And the violence, as you all know very well, is unprecedented. And the cruelty, beheading people and hanging them from the overpass. And we have to work to stop these drug cartels. Otherwise, you are going to see the government of Mexico fall and in a way that corruption will have taken over. And by the way, I'm sure you've seen the articles in the newspaper. Some of that corruption, because there's so much money, is on our side of the border as well. So I think we have to secure our borders because of illegal immigrants. But I'd also tell you that the drug cartel problem is a huge one. And the corruption, unfortunately, reaches up to the highest levels of the Mexican government. We've got to work with them. And one of the reasons why we have to work with them, a lot of those drugs do stop in Mexico. But the majority of the drugs, as you know, the destination is the United States of America. So I commit to you, Randy, that I will continue to do everything I can to secure our borders, not only because of the illegal immigration, but because of the drug cartels. Let me just say one experience I had a couple of weeks ago. I was down in Yuma. They discovered, as they do all the time, a tunnel underneath the border. And it cost the drug cartels $1 million to dig that tunnel. What did they care? They're making billions. So it's a huge problem. I commit to you I will continue to work on it. And I thank you for your past support. Yes, ma'am, all the way in the back.
This is a picture of my granddaughter. She'll be 3 years old on Saturday. And she has cystic fibrosis. There are 30,000 American children and adults that have cystic fibrosis. And I can tell you that with this government option, I haven't read all of the bill, but I've read quite a bit of it. And it is frightening. The seniors and people like Maya, there will be rationing health care. And in addition,
Oh, hush up.
please let me finish. And in addition,
You're the liars over there.
the Cystic Fibrosis Foundation, through with the help of pharmaceutical companies, do a lot of research, and they have made great strides in helping people like Maya live normal, productive, longer lives. I'm afraid when this government option is passed, Maya's life will not be worth anything to the government. And in addition, and this is just my opinion, and I don't know if anybody else feels the same way as I do, but I of career politicians in the United States Senate and the Congress. You all need to go, and it is time that we pass an amendment to the Constitution to instill term limits for everyone.
Thank you. I think you expressed the frustration and that a lot of people feel, particularly in this issue of government control of the healthcare system. At a town hall meeting that I had yesterday, a young woman said, Senator McCain, I'm worried about losing my freedom. And I think and I hear that a lot, and I think is that under this plan, when you read this bill, you read all these 600 pages and 1,000 pages in the House bill, you'd see that this legislation controls insurance, it controls individuals with mandates, it controls employers with mandates and taxes and penalties, and it controls doctors, and it controls hospitals. In this bill, there's 1,100 new government requirements. So I understand your concern, ma'am. Our thoughts and prayers go out to your granddaughter, Maya. And I want to assure you we'll do everything we can to make sure she has the care and the treatment that she needs and deserves as an American citizen. I thank you. Come right.
I'm an HIV patient since I was 6 years old. My issue, the first one is with Medicare. I've been on Medicare for about 3 years now, and they do not cover any dental coverage. I've lost 5 teeth because of decay underneath the crown. I can't have them removed because I can't afford it off medical necessity. I have no immune system, and I have decay and infection in my mouth, and they won't remove the teeth. Now, access will remove the teeth, but I've never, my disability income is too high. I've never been eligible for access. That's my next issue. To me, a simple reform of access program that would accommodate a lot more people is if you're over the $850 limit, I make $1,100. I'm not eligible. I wasn't for years. I was paying $650 a month for a portability plan. Had my house go into foreclosure because I'm trying to keep health insurance. Now, all they have to do is put a sliding scale over the top of that 850, whatever that sliding scale has to be to make it work fiscally, and get it done. If I had to pay $350 a month, that's a lot better than $650. Might still be unaffordable for some, but it still opens it up for a lot more people. It wouldn't cost the government a penny. Because they run it just like an insurance company, where the premiums have to cover the claims. Simple deal.
Right.
You guys seem to make it all complicated. Thank you.
Thank you. Thank you for the ideas and suggestions and proposals. And I would look forward to having my staff discuss it more with you to try to make sure that, because you obviously make the case that we are in the end costing the taxpayer more money if you become seriously ill, then exactly. Thank you. I would be more than happy to have our... Yes, sir. Let him go ahead. Go ahead. Are you done? Okay. All right. Okay, thank you. Thank you very much. Yes, sir. My name is Winston. You have to hold the...
I have MS.
I'm sorry. I have 3 people, someone close to the problem. My medication alone costs over $40,000. That's not doctors, specialists, therapy, orthopedic devices, just medication. And without my medication, I can't even see. I have another gentleman who had the exact same plan as I do, but he changed to Medicare Advantage. He had the same secondary, the same Medicare, goes to the same pharmacy, gets the same thing, but we're paying the state or whoever for Medicare Advantage, and there's no better coverage. Another person I know is self-employed. They do not make enough, and they cannot afford their insurance, and second, the insurance company won't cover them because they have pre-existing condition, yet they're not disabled, so Medicare can't cover it. Now the thing is, if this person doesn't get care, they're going to get chronically ill, and that's going to cost a whole lot of money. I just want to say something else soon. If we look at our country now, and the government, we've been pointing fingers, blaming, arguing. Let's stop labeling and criticizing and saying that's conservative, that's liberal, that's Republican, that's Democrat. Let's just look for what works and get the American people. If I didn't have Medicare, which is a public plan, which is socialized medicine, I doubt any insurance company would cover me. So to me, the public option, without it, I'd be very, very sick. Well, let me just say again, thank you for informing us. But this establishment of risk pools, as I pointed out, is exactly aimed at your situation. We must establish risk pools so that you will have the insurance that you have to have, which would provide you with the medication and the care that you deserve as an American. That's why we need to fix the problem. We need to fix the problem, and I'm committed to fixing the problem that you articulate so eloquently. Go ahead. Get private insurance. Trust me, I would. I contributed to Social Security and maxed out my benefits, and there's no way in the world I put in enough to pay for $40,000. And that is ridiculous. That medication doesn't cost it. Well, thank you, sir. proposal we have is establishment of risk pools so that you will be able to have access to affordable insurance to take care of your medical needs. And thank you for your articulate statement. And I think you identify very well one of the major problems with healthcare in America today, and that is the, quote, pre-existing condition or uninsurable. We've got to fix that. Yes, sir. Thank you. Could I? Yes, sir.
Good evening, Senator. My name is Russell Wittenberg. I'm a retired airline captain, and before that I was a captain in the United States Air Force, Vietnam era. As a pilot, and
Thank you for serving, Russ.
Thank you. And I also participated in the Cuban Missile Crisis and the Bay of Pigs. Now, with that little background, the reason I bring that up is as an airline captain with Pan Am and United both, I've traveled all over the world. And I've had a chance to compare what you said earlier about our quality of health care. You're absolutely spot on, Senator. People come here. Now, the reason I want to bring this up is because for those of you, I have read the HR 3200, all 1,018 pages of it. Right here is an abridged version. Now, for those of you people here who are for what I call the death care bill, I urge you to please get a copy of the bill, or an abridged version at least, and read what's in the bill. Yeah. Now, there's not one page, there's not one paragraph, there's not one sentence in that bill that I want codified into law. Secondly, I urge you to read it. Now, I know a lot of people here who have not had a chance to read the bill. They don't know what's in it. They're here because they think it's a good deal, or it's something for nothing, or something of that thing. Believe me, folks, this is not a health care bill. It's about a massive government power grab to change. Of the President of the United States to remake America in what I only deduct from his actions as a fascist socialist police state. Is that after you read what's in the bill, please, I would raise a rhetorical question. What thing in the bill, or what agenda in the bill, what agenda in this bill is it that you want, which is actually more powerful than your very life?
I want people to be able to go across state lines to get the health insurance of their choice. I want encouragement, wellness, and fitness. I want $5,000 refundable tax credit for every family in America to go out and get it. I want health savings accounts expanded. I want a number of things that are not included in that bill that have to be included in the bill, and there's absolutely has to be no, quote, government option, no, quote, public option in the bill. Thank you. Thank you. Some people all the way up to the top that have been waiting, go all the way up to the top, all the way up to the last row. I see you, sir.
Thank you for the opportunity to speak, Senator McCain. Just get the question up here. Okay, there we go. Every other developed nation provides universal coverage for their citizens. They all do it for a lot less money.
Yeah, but the poor people. Why do they come here?
It's true. And by most measures, they score a lot higher on quality than certainly the kind of most Americans have.
You're so full of baloney.
Let's let everybody finish their comment. Go ahead, sir.
Now, they all have different methods methods of achieving that. Most of them have some sort of public option. It seems to work quite well for them. My question, but the one thing they all have in common is no other developed nation allows health insurance to be provided on a for-profit basis. Why do you continue to support
Because that's capitalism.
that gives incentives to companies to deny coverage to as many people as possible, raise premiums as much as possible, pay out as little as possible? Why can't we just have non-profit health insurance? Why do we insist that the free market can solve this when the free market can only accumulate wealth with the top of corporations and has an incentive to deny people care and keep the money?
Because I think that competition amongst different providers is probably the best way to obtain quality care.
It's because the government's involved.
And to keep costs down. Now, I'm glad you mentioned, quote, other countries, if I could just take a second with you. In the United Kingdom, that's our British friends, the National Institute for Health and Clinical Excellence, it's called NICE, they use a thing called CER, which to decide which treatment patients can or cannot have. The United Kingdom often refuses to pay for an expensive treatment if a patient is very elderly, disabled, or medically dependent. NICE, that's what they call it, the National Institute for Health and Clinical Excellence, uses a formula to decide whether it's a good value for the government to treat elderly, disabled, or frail patients. In the past several years, the British government has repeatedly blocked breast cancer patients from receiving breakthrough drugs, forced patients with multiple sclerosis to wait 2.5 years to receive innovative new patients, and the list goes on and on. I don't want that for the United States of America.
I want my grandmother to be able to get the care she needs if she needs it. I'll pay for it myself if I have to.
Yes, ma'am. Where? Oh, I'm sorry.
I home have a picture. I with my son.
A little closer to the mic, please.
He's a special ops, brain ops soldier. He has a picture of you that he says is the highlight of his life. I raised my voice to believe that you were a hero, and I believe that you're a hero, and I'm truly grateful. Another character that you have shown in the past. Several of your decisions and your words have caused me to question that. And that's why I'm here. That my son can continue to give us a reason to know, continue to, you will be his hero. Mine. And in advance, I'm not a public speaker, so forgive me for my I'm a daughter of a lifer. My oldest son spent 4 years in the Navy. And then my son, who was a special ops soldier now. He's been in Afghanistan. There was a long time when you were the only politician that I truly believed that I could entrust the lives of my soldier boys. But there have been things that you have said that have caused me great concern. The votes you have made that have caused me tremendous need to be stunned. And if we're just going to speak upon the gentleman's question about the border. We have to strengthen it so that the drugs that we Americans are demanding causing this problem. Yet we don't have to strengthen it for the immigrants who are causing us these problems. I see it just, there's no consistency in that logic right there. But I'm here.
Well, let me just respond very quickly. There's a demand for illegal drugs in this country, and it's unfortunate that that's the case. And we have to do a better job of educating our children and our citizens about how terrible that this scourge is. But I just finish real quick. And so it seems to me that we have to do everything we can to stop these drug cartels from exporting that into this country.
That's not my point.
Go ahead.
What about the immigrants? They're coming from the Middle Eastern countries with
borders. We have to secure the borders as well. Go
Should that
ahead.
be an equal priority?
Yes, it's the highest priority is securing the borders. Please go ahead.
Okay. I'm here regarding your Patients' Bill of Rights from 2001, that you co-sponsored with Senator Kennedy and John Edwards. According to the Republican, not a
Gonna have to speed it up a little bit.
Okay, I'll talk faster, I can do that. Okay, according to the Senate, thank you. According to the Senate Republican Policy Committee analysis of the bill, it would have created enormous health insurance mandates and appeal processes that would have applied to 194.6 million people covered right now by private health insurance. The bill would have created expensive new rights to sue insurers, employers who provide insurance in federal and state courts, and the bill could hike insurance costs as much as 31% over 2 years. Nearly half of employers said they would drop employee health coverage if Congress passes legislation exposing them to increased liability. And it continues from there, and I can go on, including the fact that you voted against a cap for attorneys, and I can tell you the bill. You know that bill.
Honestly, I don't.
Okay.
I've never been trial lawyers have never been my strongest supporters.
Okay, Amendment 831, Senate Amendment 831. Okay, it would have capped the fees for personal injury lawyers who represent plaintiffs filing suit under any of the various new causes.
Ma'am, in all due respect, I have cast thousands of votes, and I'm not familiar with a single vote. I'd be glad to tell you, my advocacy for the people of this state and to have affordable and available health care and record is very, very clear, and you can use any measurement to determine.
Senate Amendment 848, providing liability.
Thank you very much. If you would give me those details, I do not recall Senate Amendment 848. I apologize to all my constituents that I do not, but I would be glad to respond and stand on my record. And I thank you very much. Thank you for your involvement. Thank you so much. Yes, ma'am.
Yes, sir. Senator McCain, thank you for your service. One of my brothers served 3 tours of duty in Vietnam. My other brother served 2 tours of duty in Vietnam as Marine, and my youngest was Marine, and my uncle was a POW with you at the Hanoi Hilton. God bless them all. Senator McCain, about this health care, I don't understand how any Democrat or Republican could consider putting their signature on this bill when they cannot give us a cost. I want to know how much per month, per poor person, per senior citizen, per child, baby, man, woman. You wouldn't buy a car at the Cash for Clunkers, they gave you a price. Why don't they give us a price? I can't imagine going to get a job and they say, you want health care, just sign here, but we're not telling you how much it's going to cost you.
Ma'am, let me just say that. Thank you. I can't break it down for you, but I will try to get the exact breakdown per person in America. But I can tell you, as I mentioned earlier in my remarks, the Congressional Budget Office says that it's $1 trillion or more. And what's even more alarming than that, there has never been an entitlement program or expansion of government that didn't exceed the initial estimate of how much it cost. I'll try and get you that information. Is there anybody up in the top there that yes. Yes, sir. All the way up the top. Yes, go all the way to the top. Thank you. I'll try and get a breakdown of that information for you, but it is $1 trillion right now.
Thank you, Senator. My name is Michael Stasek, and I want to ask you one question about those 1,100 government programs you said in this bill. On page 65, there's a $10 billion entitlement to subsidize union pensions for people from family. Why is it in the health?
Good question.
me just mention one other thing about this bill that went through the Senate side, my friends. There was an amendment by the senator from Maryland, Senator McCain, that had to do with, quote, women's issues. During this amending process we were going through, the question was raised, then does that mean that there will be federal funding for abortion? And they said, well, we're not sure, back and forth. So one of the members who is pro-life proposed an amendment prohibiting any federal funds to be used for the purposes of abortion. That amendment was defeated. That amendment was defeated by the majority of the Democrats. My friends, I will never support a bill that uses your tax dollars for abortion.
You can't buy insurance right now unless they run a credit report on you. Why in the world are they running credit reports when you pay for it up front? Then, if you price it up, every time they check your credit report, they put it, your number goes down. So then it's going to cost you more because you're pricing it. You got to get control of this credit report.
Yes, sir. I agree, but I also don't think we ought to ignore the underlying problem, and that is that the cost of health care has had double-digit inflation associated with it. The cost of health care, no matter what, even though that's a problem, credit ratings, but even more, and really the underlying problem, is the double-digit inflation associated with health care, which has caused the Medicare trustees to tell us that just in 8 years, that Medicare is going to go broke. We can't do that to you. We can't do that to the young man that was just here. We've got to, we owe the American people affordable and available health care, but not a government takeover. There's some people right there. Yes. Yes, sir. No. Yes, sir.
It'll be mandatory in the future.
And then, yes, ma'am, we'll give him first, and then you'll be next. There you go. Thank you.
Senator McCain. My name is Zachary Ortiz. I'm sitting here today with 3 of my fellow medical students from the University of Arizona College of Medicine. And I'd like to just say to you today that we do support the principles of healthcare reform that have been delineated thus far in the form of a public option, and I'd like to express to you
You're academia,
As it stands, our system is based on a series of perverse incentives, which many of you have mentioned, that basically line the pockets of very, very wealthy corporate executives of pharma, Senator McCain, and which also reward their shareholders. Bottom line is that they have to answer to their bottom line, as they do in a capitalist economy. Now, that said, we've created nearly 46 million people who are uninsured, and we also know that the lack of preventative health care in that context is going to lead to increased costs over time because of chronic health conditions. So what I want to know is, from a legislative standpoint, Senator McCain, what are we going to do to fix this perverse incentive system that is clearly polarizing the costs, creating more health disparities, which, by the way, I intend to go into family medicine, but many of us who have
stay away from my family.
Debt choose to go into specialties just for the purpose of paying back our loans. So I'd like to know what type of things that you support in addition to tort reform, in addition to supporting wellness incentives and the things that you've mentioned that are going to help support primary care, limit the essentially the excess expenditures that are going to help the industry.
Thank you. To incentivize people to remain as family practitioners. One is outcome-based treatment, such as we have at Mayo and other institutions, where you take a patient that has a certain situation and you pay the provider for the outcome of that patient after a period of time and the health of that patient. That reduces and eliminates many of the excess costs that you're talking about. I'd like to ask you, You know physicians that prescribe unnecessary procedures and tests? Do you?
I know that it is currently common that many physicians do order additional tests because of the basically litigation.
There you go.
Let's remove it.
Yes.
In addition, excuse me.
Go ahead.
I do know, and I'd like to point out that I have worked at the Mayo Clinic, and they do not have a family medicine residency program because they are very specialist oriented. I also have 2 relatives that work at the Mayo Clinic.
Yes.
But yes, many medical doctors do order tests that are delineated in the guidelines, but a lot of us feel bound because there are guidelines, numerous guidelines. We're talking AAFP, we're talking numerous national standards that are not coherent. So the question falls upon us as to which guideline do we follow in order to make sure that we're not subject to litigation, when really all we want to do is follow the most evidence-based standard of care and make sure that our patients are getting the best line of care possible.
That is exactly necessary, and I hope that could be part of a significant part of the reforms that we need to make. But I would also argue that a lot of that, the latitude that you would have if it was an outcome-based treatment of a patient would probably give you more latitude than you have today in prescribing specific procedures and tests, not only because of the fact of litigation, but also the fact that the reward and incentives there are to make sure that that patient is well. By the way, there's another program where we allow seniors a certain amount of money, and the seniors go out and purchase their health care. Now, a lot of people said, don't do that. Seniors aren't capable of doing that. Guess what? They have been the most efficient of anybody. And that's because they know what's best treatment for them. And the one thing I want to do for you and your fellow students, and thank you for entering a very honorable profession, is to not get the federal government between you and your patient. And take the steps necessary.
What we have here by a long shot. Anybody who has had gallstones and know what the pain is, imagine waiting 18 months for your surgery. Imagine that your doctors can't work certain hours of the day because it costs them money in their taxes because of the federal regulations. You get emergency care, but you don't get good health care. Imagine being on the operating table with a doctor who is going to make decisions about the quality and quantity of your life, and you have never met him or her. And the person who makes the decision who that doctor is somebody you have not met. There are problems. We have the best health care. We need to find ways to deal with it. We also need to continue to fund the best research doctors we have in the world. My question to you My question, Senator, is we have a lot of problems with the fiscal nature. Would we free up money to solve problems if Congress had a germaneness rule so that every bill that went through was germane to one issue? And you couldn't tag all the things.
Yes, and in addition, and could I answer and then I'll let you go? In addition to that, give the President of the United States the same power that 43 governors have in America, and that is the ability to line item veto.
I'm not sure whether I like line item vetoes or not.
The President of the United States has 2 choices, either veto or sign. That shouldn't be when you've got a bill this size coming across his desk.
Arizona has a germaneness rule in our legislature and have for a long time, so we know it can't be done. The question is, why do we not have that in Washington? And if we don't, why is it not